Hello again, everyone. My name is Mandy, and I am in Dr. Clem's clinical group, and I will be doing this video discussion on a high-risk newborn situation. The scenario is, imagine that you are caring for a critically ill preterm newborn in the NICU. The newborn has developed numerous complications and the prognosis is quite poor. The parents are adamant about wanting everything done to save the newborn. The first question is, what do you think your reaction to the situation would be? And the second question is, what factors might affect your reaction? So this discussion post I felt was a very tough one because, I don't have any children for personal, I don't personally have any children, so that kind of made it difficult. And I do have a very different outlook on this. So my initial reaction would be I'd be very shocked, wow, are you sure you want to do this, and I say that because a little background knowledge of me. I work a pulmonary floor in a hospital. I have been doing so for 9 years and some months now, and the types of patients we get there are a lot of patients on ventilators, on life support. We're kind of doing all the care they need, everything, all the feeding, turning, cleaning, everything for them. What I can say about this situation is we do get a lot of these families and these patients, they come back to our floor a lot. These patients have been living in this state or these conditions for years. So we really get to know the family and get to know the patient. Which this can make it hard because I also get to see all the emotional stress that the family experiences. I get to see different things that happen to the patient, including sorry, I didn't know if my thing cut off. I was saying, I get to see different things that happen to the patient, such as, they're getting multiple infections, they're getting pressure ulcers develop, all different kinds of things, infections relating to, they get an infection from the urinary catheter, or they end up with an infection in their trach, a multitude of different things. So in this situation, it's very hard for me because I feel like over the years, I have gotten compassion fatigue, I would say, because I have been burnt out, because it has been very stressful and saddening to see us do all these things for these types of patients, and there's just nothing more we can do to make it better. And it's kind of where I feel like sometimes we may just be torturing them. And it's also very hard, of course, when we lose them, because, we're we thought we could do everything to save them, and it's just not what happens. So I will say I do have some positivity about the situation, though, because I have seen patients who are in a poor prognosis as such, they say, oh, there's no coming back, or oh, this is what, their brain activity looks like. And I have seen patients who have had a stroke, and a couple months later down the line, they start to react and, start to talk, and they start going through rehab and learn to walk, and it's kind of an amazing feeling. So I do have that positive outlook too. It's just a difficult situation because I have seen, of course, less positive outlooks than I have compared to positive ones. So for this newborn baby, of course, I have to set my own opinions all aside, because I really have to be there and be supportive for mom and dad, get an understanding of why they want to move forward with this care. Are they experiencing any grief? Are they experiencing any guilt in the situation? Like, why is this their choice? Get a better understanding of why that's their decision. Is this their first child? Or those are important questions to ask. Also, I think it's important to make clear to the family, even with all these interventions in place and all these different tests being done, or, surgeries being done, that the baby may still not even make it in the end. And I think that's important to have them clearly understand, because I think they need to think about, is this how you want to see your baby for the last couple of days? Do you want to see them in pain? Do you want to see them at risk for all these different infections? Do you want to see them go through these surgeries or these different things? Or do you want to just, spend time comfortably with them and making sure the baby is comfortable? Also, another thing I would think it's important is to explain to the family about, what kind of stress this is going to put on them. How is this going to affect their emotional state, when they're like at work, out doing other things, spending time with their family. It's always going to be stuck in their head that their baby's in the NICU, and it's just going to take a toll on them emotionally wise. It's also important to, explain to the family the kind of financial issues or financial strains this will put on them. I have seen families who have lost everything and tell me all the time that they are, losing this house, or they worry about, like, their person is sick at home. Who's going to care for them? Are they going to find the right person to care for them? All kinds of things like that, because with medical treatments now, we have learned that, we can have these patients who are, or, babies, older adults, children, everything. With all these medical advancements, we've been able to keep them alive for years. I have seen patients with spina bifida, and they're just going on into living into their 30s and 40s with no problems. I mean, obviously they are having problems because they are admitted into the hospital, but usually with spina bifida back in the day, your life was cut drastically short. But as I was saying, yes, it does take a big financial toll on them as well, and that also needs to be considered. Some different factors that may affect my reaction include, is this the family's first child, or is this the family's, fourth or fifth child? They should have an understanding of how that can affect the other children. Other children do grieve. They just, kind of show it a different way. I was kind of reading into it. They can grieve as intensely as adults. They just may show like a lack of interest in their normal activities, or like regression in behavior. They may be angry or act out. So that's important to understand, because, the siblings are going through this just as much as the parents are. And they may feel like they are just like losing their parents to that situation. I would also be affected by, was there anything that they could have changed, that, like, is that why the baby was born preterm? Is this why this baby is in such poor health? is because of decisions, you know, the mother was making while this happened, or, you know, the father is involved too. Like, for instance, I had a patient who was born with a weird, like, chromosomal, like a genetic issue, and it happened pretty much with every single one of her sons. I have to remember what it was called because it was really interesting. Every single one of her children that were sons, they all had it, and they all ended up, you know, with multiple health issues down the line. Ended up, you know, trach on ventilator, on full life support, only living to about like 18 years old. And it's kind of like, wow, like, you know, like with that being such a risk, you know, that happened to all of your children. And this patient, or the family member, should I say, actually kept having these children with that condition until they were able to have a girl that was healthy, which I do understand, you know, because you do want the healthy child, but it's also like you're putting yourself through so much, and, you know, your other children who are living beings as well, just so you could get to that point. And, you know, I also say, like, it's important, you know, what if mom was like smoking or drinking or doing drugs during her pregnancy, and this is why all these issues came about? So that would affect me too, because I would be like, wow, like, you know, that's really selfish. This is why this poor baby is in the situation they're in. Also, something simple as, you know, we see abuse a lot, you know. Was mom with a guy who just kept laying his hands on her and caused trauma to the baby? And these are just, you know, different things that would affect my thinking about it. I do say, yeah, this is a difficult situation. And of course, the most important thing is to just let the family express their concerns. You know, are they feeling guilty? Are they grieving? Are they stressed? You know, do they not really know how to proceed? Or do they have an understanding of all the things that could happen, all the things that could go wrong? Or, you know, do they want to see, you know, just the child comfortable and spend, you know, their time with them, just as a normal family? And, but like I said, it's also important, you know, there could be a turnaround. Something may happen, something may take place that everything changes, and it could have a good outlook. So it's really important, I believe, just to talk to the family, and maybe have the family reach out for counseling too, or, you know, reach out to social work, reach out to other family members, or find someone who may have dealt with the same situation, kind of get their opinions and feelings on it. And that's really all I have. Thank you.